Hey there, and welcome. Today we're going to talk about something pretty serious. What happens when your blood pressure, a number most of us check pretty casually, suddenly skyrockets into a life-threatening danger zone? This is called a hypertensive crisis, and knowing what it is, well, it could literally save a life.
And this is the number that kicks off the entire emergency. When you see a blood pressure reading that's higher than 180 over 120, you're officially in crisis territory. That top number, the systolic, is the pressure when your heart is actively pumping. And the bottom one, diastolic, is the pressure when it's resting between beats. When they're both that high, it's a sign that your whole system is under an incredible amount of stress.
All right, so here's our game plan. First, we'll define what this dangerous spike really is. Then, we'll get into the critical difference between an urgency and a true emergency. And trust me, there's a big one. After that, we'll see how the body is actually being attacked, how doctors fight back, and we'll wrap up with the most important takeaways for you.
Okay, let's get right into it. Part 1. What in the world is a hypertensive crisis? So the official definition calls it a severe and acute elevation. And that word acute is everything here. It means this isn't just your standard high blood pressure that's been creeping up for years. No, this is a sudden, dramatic spike that needs to be taken seriously right now.
Now, check this out, because this is what's really eye-opening. You'd think a crisis like this would only happen to people who already know they have major blood pressure problems. But get this, almost a quarter of the people who land in the ER with one, they had no clue they even had hypertension. For them, this crisis is the very first warning sign, and it's a huge one.
And that leads us to maybe the most important part of this whole explainer. You can have that same scary high number, but the situation can be totally different. We're talking about the crucial distinction between a hypertensive urgency and a hypertensive emergency. See, that 180 over 120 number, it doesn't tell the full story. The real question, the one that separates these two, is this. Is that pressure causing acute organ damage? If the answer is no, it's an urgency. It's serious for sure and needs to be brought down with oral meds over hours or days. But if the answer is yes, well, that's a true emergency. It means your body is actively being harmed and you need to be in a hospital with an IV right away. So how would you even know if your organs are being damaged? Well, these are the alarm bells. These are the signs your body is screaming for help. We're talking about a headache that's just off the charts severe, blurry vision, sudden confusion, chest pain, or that terrifying feeling where you just can't catch your breath. Any of these could mean an urgency has crossed the line into a full-blown emergency.
And just to underscore how high the stakes are, listen to this. This quote shows how incredibly deadly a true hypertensive emergency was before we had effective treatments. Now, obviously, modern medicine has changed the game completely, but the raw danger of what's happening to the body, that hasn't changed at all.
Okay, so we know it's dangerous, but how? How does that extreme pressure physically damage your body? Let's take a look at the mechanics of what's going on inside.
I want you to think of your blood vessels as a system of pipes. A sudden pressure spike is like hooking a fire hose up to pipes that were only built for a garden hose. That intense force first damages the delicate inner lining of your blood vessels. Then, your body's own defense systems, the ones that control blood flow, they just get overwhelmed and they fail. And that leads to the final, devastating step. Your vital organs get starved of the blood and oxygen they need to survive.
In which organs are in the direct line of fire? Well, you can think of them as the big three: the brain, the heart, and the kidneys. In the brain, this pressure can cause a stroke. In the heart, a heart attack or heart failure. And in the kidneys, it can cause them to shut down completely. These are the prime targets when the body is under this kind of siege.
Okay, that's the problem. And yeah, it is a big one. But now let's switch gears and talk about the solution. How do doctors and nurses step in and manage this kind of crisis?
So that gets us to a really interesting question. You might think, if the pressure is super high, you should just slam it back down to normal as fast as you can, right? Well, actually, that's not the case. It's a bit more complicated than that.
In most situations, this is the magic number, 25%. The goal is to lower the blood pressure by no more than 25% in the first hour. Why? Because if you drop it too fast, you can actually cause another huge problem: shock. Your organs have gotten used to working under that intense pressure, and if you suddenly pull the rug out from under them, they can't get enough blood flow.
It's all about a controlled, gradual descent, not a crash landing. So after that initial 25% drop, the goal is to get the patient to a safer, more stable level over the next few hours, and then, slowly, carefully, bring them back toward normal over the next day or two. It is a very deliberate process. But there are some major exceptions to that 25% rule. For some absolutely life-threatening conditions, like an aortic dissection, where the main artery in your body is tearing, you have to bring the pressure down, and you have to do it fast. The same goes for crises during pregnancy, like eclampsia. In those cases, the danger from the high pressure is so immediate, it outweighs the risk of dropping it quickly.
All right, this brings us to our last and honestly most powerful section. We've talked about the danger and the treatment, but the best medicine of all is prevention. So what do you need to take away from all this?
Here it is. This is your playbook for preventing a crisis. The number one reason people end up in a crisis, it's often because they stop taking the prescribed medication. So consistency is absolutely key. And beyond that, it's the stuff we all know we should be doing, right? Keeping an eye on your pressure, watching the salt, staying active and at a healthy weight, and cutting back on alcohol and smoking. These are your best lines of defense.
And this quote right here really sums it all up. There's a reason they call hypertension the silent killer. You might feel totally fine, which is exactly why you can't rely on symptoms. Regular monitoring and taking your medications, even when you feel great, is what stops a crisis before it ever begins.
So we'll leave you with this final thought. Your blood pressure is constantly telling you a story about your health. The real question is, are you listening? Thanks so much for tuning in.